Hello and welcome to a lesson in science, a topic that is so important that everyone is talking about today, that is health and diseases. And in this video, we will study only about infectious diseases. When we talk about health, we also have to talk about the other side of the coin, and that is illness or disease. Health is a state of complete physical, mental and social well-being of a person. So I can't say that, I don't have a fever, so I am healthy. To say I am healthy, I have to not have any physical problem. I should be mentally okay, that is in my mind, and I should be able to have relationships, good relationships with my friends, my parents, my siblings, and with everyone else. So if all these three, the physical, mental, and social well-being of a person is good, then we say the person is healthy. On the opposite side of health comes disease or illness. Now, disturbances in physiological or psychological processes of the body is called disease. Meaning, we have problems, the physical problems of our body where we have fever, cough, cold, and more severe diseases, or there can be psychological or mental illnesses that we have. So either physical illnesses or mental illnesses are both called disease. There are two types of diseases. One depends on the duration or the time. Now that is either chronic disease or acute disease. A chronic disease is one that stretches for a very long period of time, like diabetes or cancer. And an acute disease is there for a very short period, like a cold, a cough, a fever, etc. Now the next type of disease depends on the reason. There we have either hereditary diseases or acquired diseases. And then we have acquired diseases which are either infectious or non-infectious. Now hereditary diseases are those which are got from the parent and given to the offspring or the child. For example, Down syndrome. Now, acquired diseases are those which we get from the environment or we get due to our lifestyle. Now, those could be infectious, like, we get a common cold from someone, or you get a fever from someone, or it can be non-infectious, that is diabetes and flu. Let us begin with infectious diseases. Diseases that spread through contaminated or polluted air, water, food, or vectors like some animals and insects that carry disease germs. Those diseases are called infectious diseases. If you look at this picture here, you will see the man sneezing, okay, and how whatever comes out from his mouth remains in the air for several minutes to a few hours. The larger droplets of water or the water vapor, they fall on the ground within a few seconds. But the finer particles, they spread all over. And therefore, anyone coming within that radius of wherever his spit or sputum has gone are exposed to infection. See how when you sneeze, what happens? And a person who is within that radius over there is going to get infected if this person is suffering from some disease. So this is infection through sputum or saliva or spit. Tuberculosis. The disease-causing organism is Mycobacterium tuberculosis. It is a bacteria. The mode of infection or how the person gets infected, it is because the patient may be spitting through air or by contact or sharing things with the patient or a person who has already got tuberculosis. What are the symptoms of TB? Cough, spitting blood, emaciation means losing a lot of muscle or weight, difficulty in breathing. Now, how are you going to prevent and treat tuberculosis or TB? One is by BCG vaccine, which is given as soon as the child is born. Patient isolation, meaning keeping the patient who is suffering from TB away from other people in the family. And regular medication like DOT. Next, infectious disease, hepatitis. The disease causing organism may be virus, hepatitis virus A, B, C, D or E. The mode of infection, or how do we get infected by hepatitis, is by contaminated or polluted water. Sharing needles when we take blood out, when we go to the pathology lab, or by blood transfusion. You can see this man here having blood transfusion, and he could be taking in somebody's blood, the blood of an infected person. The symptoms of hepatitis are anorexia, where a person won't eat, yellow urine, weakness, nausea is the feeling of giddiness and vomiting and grey stools or motions. How do you prevent this disease? By drinking boiled water and personal hygiene by cleaning your hands properly. Another infectious disease, dysentery, and the disease causing organisms may be bacteria, virus, Shigella, bacilli or Entamoeba histolytica. The mode of infection here, contaminated or polluted or not good food and water. Now, what are the symptoms of dysentery? Watery stools, that are motions, and pain in the abdomen. The prevention and treatment of dysentery: drink boiled water, store food properly, cover your food, see that no insects or other creatures can go towards the food, and the consumption of ORS, which is oral rehydration solution, because when you have dysentery you have lot of watery stools, so everything goes out of the body including the water, and therefore we have to have this ORS, put it in the water, and so that your water is come back into the body. Another infectious disease, cholera. The disease causing organism, Vibrio cholerae, which is again a bacteria. The mode of infection, contaminated or polluted or not good food and water once again. The symptoms, vomiting, severe diarrhea, that is pain in the stomach and loose motions, cramps in the legs. Now, how do you prevent cholera? By being hygienic. Hygienic meaning to see that you are keeping yourself clean, by drinking boiled water, eating hygienic food, and by vaccination. Typhoid, where the disease causing organism is Salmonella typhi or bacteria. The mode of infection once again is contaminated or polluted food or water. The symptoms are anorexia, where the person doesn't want to eat and gets full of bones, the muscles get wasted, headache, a reddish kind of a thing on the abdomen area, dysentery and fever up to 104 degrees. How do we prevent typhoid? By drinking clean water, vaccination or proper disposal of sewage. Now, sewage is the water that you get from your toilet, bathroom and the kitchen. It is polluted or contaminated water, and that water cannot be just disposed in your surrounding areas. It has to have a separate sewer system, pipelines going and taking it to the sewage plant. If we don't have that and we allow this water to collect all around our house, then you are putting yourself at risk to get the infectious disease called typhoid. Another infectious disease, enteritis. The disease-causing organism is E. coli, and once again the mode of infection is contaminated or spoiled, or food and water which has disease-causing germs. The symptoms are pain in the abdomen, fever, diarrhea, headache, and we can prevent this by washing our hands, eating good hygienic food, and drinking boiled water. Malaria, disease-causing organism, Plasmodium vivax, ovale, malaria, and falciparum. Now, the mode of infection is the bite of the Anopheles mosquito. Now, this Anopheles mosquito carries the disease-causing organisms Plasmodium, Vivax, Ovale, and the others. Okay. Now, when it bites a person, it transfers these disease-causing organisms into that person's blood, which it bites. And that is how the Anopheles mosquito is a vector or a carrier of the disease-causing organisms which cause malaria. The symptoms are pain in the stomach, high fever, diarrhea, headache. Chills means we feel very cold and shivery, and vomiting. To prevent this, we need to use insect repellents like Odomus, especially when we are going into places where there are lots of mosquitoes. And when you sleep, you can use a mosquito net. Another infectious disease, plague, caused by Yersinia pestis, which is a bacteria. The mode of infection is it is caused by the bite of fleas that live on infected rodents. Now, rodents are rats. Okay. How do we get plague? By the bite of fleas. Fleas which bite us, and these fleas, they live on the rats which are infected. The symptoms are chills, that is, again you feel cold, shivery. Fatigue means extreme tiredness, muscle aches, difficulty in breathing, fever, and headache. How to prevent this disease called plague? Keep pets free from fleas. So if you have a dog or rabbit or any other pet in the house, check and see whether they have fleas. And there are medications and there are things that you can use on pets to keep the fleas away from them. We can also use insect repellents, that is HIT and other things. And keep your home rodent free. Rodent meaning all different types of rats, mice, etc. So your house should not have rodents. Otherwise, there's every chance that you might get plague. Another disease, AIDS. Disease-causing organism is the human immunodeficiency virus, or HIV for short. The mode of infection is only contact with infected blood. So if the blood of an HIV patient reaches your body, then only can you get AIDS. What are the symptoms? Rash, that is a reddish thing that comes on the body. Sometimes it itches, sometimes it burns. Sore throat, then the throat starts paining. Mouth sores, that is boils all within the mouth. Weight loss, a person loses weight, and swollen lymph glands. How can we avoid this? Be careful during blood transfusion. When you're taking blood from someone, that blood should be checked and seen that the blood that you're receiving does not contain the HIV virus. And always when you go to a pathology lab and you're using any needles, see that they are needles that are packed, not used by somebody else previously. Now, infections through animals. Rabies is one such infection. It is caused by a virus, therefore it is a viral disease. It occurs due to the bite of an infected dog, monkey, rabbit, etc. Okay, so you see this black dog here, how it looks rabid. It doesn't look normal like the other brown dog. And if we get bitten by such an infected dog, then there are chances we can contract the disease called rabies. Now, the virus enters the brain via neurons. We have some small things in the body that pass messages to the brain called neurons. And this virus enters straight into the brain. Now, hydrophobia is an important symptom of rabies, where the person who is having rabies will not want to go next to water. Just not want to go next to water. That is called hydrophobia. Okay. It is a fatal disease, meaning a person can die due to rabies, but this can be prevented by vaccination before the onset of symptoms, which begin to show within 90 to 175 days of the dog's bite. So if you have got bitten by a rabid dog, you can die of that disease, but you can prevent this by vaccination. Immediately go get yourself injected, by some injections. Yeah, because the symptoms only begin to be shown within 90 to 175 days of the dog bite. Okay. Yeah, so these are some other facts about rabies. And the symptoms of rabies may be fever for 2 to 12 weeks. Exaggerations in behavior, the person starts behaving not normal, be very angry or very sad or feel like crying, such different types of behavior. And hydrophobia, as I already told you, all people who are having rabies will not want to go next to water. And finally, this is what we want for every one of us, to be wealthy, to be healthy, and then we can be happy.